Bismillah ar-Rahman ar-Rahim. The types of systemic sclerosis. As we know, systemic sclerosis affects women more than men, with the ratio of women over men is 4 to 1 and has HLA associations and often presents in the fifth decade. It is largely a clinical diagnosis and there are several types. The limited cutaneous type represents or present in 60% of systemic sclerosis cases. The patients often have long-standing Raynaud's phenomena developing numb-pitting edema of the fingers, which becomes sausage-shaped, develop thick, shiny skin after a few weeks to months. Later, they can develop skin changes on the hands, face, and neck, and microstomia, digital and facial telangiectasia, intra and subcutaneous calcification, and esophageal dysmotility in 74% of cases. Patients can also develop pulmonary fibrosis in 26% of cases, pulmonary hypertension in 21%, and the cardiac 9%, esophageal 90%, and the renal disease 8%, but less common than in diffuse cutaneous disease. The second type is diffuse cutaneous systemic sclerosis, which has abrupt onset disease with widespread symmetrical, itchy, painful swelling of fingers, arms, feet, legs, and face, and is associated constitutional symptoms are present. There is edema, which is replaced by tight, shiny skin bound to underlying structures extending proximal to the wrists within a few months. There is cutaneous thickening as well as hypo or hyperpigmentation. Raynaud's phenomena is present as well as skin sclerosis on the trunk and the upper arms, arthropathy, renal disease in 80% of cases, pulmonary fibrosis in 41% of cases, pulmonary hypertension in 17% of cases, and the cardiac disease in 12%, and the gastrointestinal disease in 90% of cases. The third type is overlap syndrome or mixed connective tissue disease, which has features which have features of systemic sclerosis together with those of at least one other autoimmune rheumatic disease such as SLE, rheumatoid arthritis, and polymyositis. And over time, other organ involvement may develop and evolve into a more defined disease. The fourth type is systemic sclerosis sign or seen scleroderma vascular or fibrotic visceral features without skin scleroderma. Again, systemic sclerosis, thin scleroderma. There is vascular or fibrotic visceral features without without skin scleroderma. May or may not have Raynaud's phenomena and may develop interstitial lung disease, esophagitis, arrhythmias, malabsorption, pseudo-obstruction, renal failure in more than 2% of cases. Environmentally induced continuous but result from exposure to vinyl chloride, pesticides, or epoxy resins. This is the last type, which environmentally induced sclerosis, systemic sclerosis, which may result from exposure to vinyl chloride, pesticides, or epoxy resins. The pulmonary complications are the most common cause of death in systemic sclerosis.